I want to welcome everybody to the May 1st Sandag Board of Directors meeting. This is a difficult time for the region, grappling with a pandemic and resultant economic shutdown. And for that reason, I think it's important to have timely information from our region's top health and medical professionals as we all work to help our communities respond to the COVID-19 crisis. Sandag's in a unique position as a government agency because it provides a forum for all elected and appointed leaders to gather together to discuss critical issues facing our residents. This is one of those times, so I appreciate you making time for this meeting, and I look forward to our discussion today. I want to go ahead and start with the Pledge of Allegiance. If we can get the flag up on the screen. Please join me as we pledge. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all. Before we jump into the meeting, I'd like to ask our clerk, Tessa, to confirm that we have.
Yes, there is a quorum for this meeting, Chair.
Thank you, Tessa. Okay, a few housekeeping notes. Today's meeting is going to be a little bit different than our previous ones. First, I'd like to encourage all of you, all of the primary voting members, to please turn on your camera when you would like to speak. There should be a camera icon on the control panel on the right-hand side of your screen below the microphone icon. You can click on that to turn it on. Given the importance of what we're discussing today, I'd like us all to be seen as we speak. I will tell you, though, there's limited real estate on the screen for cameras that can appear at any one time. So even if it doesn't work the first time, please try again, and we'll make room for you when it is your opportunity to speak. Second, today we're asking you to mute and unmute yourselves, a little different than we've done before. So look for that mute and unmute button, microphone icon. Please be mindful of this and keep yourself muted until you're called on to speak. Third, if you have a question or comment, please turn on your camera and physically raise your hand, wave, do something, and I will call on you in the order that I notice you. You're not going to have the option to raise your hand virtually as we've done in the past, so your camera will need to be on to be recognized. In a worst case scenario, you can text Tessa or myself to let us know that you think you're being ignored. So again, turn on your camera to speak. Keep yourself muted until called on. Physically raise your hand if you want to speak. Hopefully that answers any technical questions for today. Everybody good with that? Good. We will save non-agenda comments until the end so we can jump right into our very important topic. I have invited the County of San Diego's Public Health Officer, Dr. Wilma Wooten, Chief Medical Officer, Dr. Nick Ifantides, Senior Deputy Counsel, Lisa Macchioni, to speak with us today so that we can hear firsthand from our public health professionals about the steps that are being taken to respond to the COVID-19 pandemic and the factors being considered to determine next steps. This is our opportunity as mayors, council members, supervisors, and agency leaders to hear from and ask questions of the experts who are guiding the region as it works to stop the spread of the virus. Thank you for joining us here today, Dr. Wooten and Dr. Ifantides. I will hand the floor to you.
Chair Voss, before they begin, this is Mary Salas. I still cannot get video, so will I be able to make comments without video?
Yes, you will.
Okay, thank you.
Go ahead, Dr. Wooten and Dr. Ifantides.
Thank you for the opportunity to speak to your board today. So I was asked to talk about the state's plan and the federal plan and where we are, and I'll do that together as a combined presentation. And actually, on Wednesday, we actually can send you the PowerPoint presentation, and I'm going to be updating that again today, so we'll send you today's presentation. But we are utilizing the federal guidelines for Opening Up America again, as well as the California roadmap to modify the stay-at-home order. And if we focus on the federal guidelines, there are 5 metrics that are part of a gating criteria. And
Please mute the extraneous voices. Thank you.
yes, the 5 metrics related to the gating criteria. The first 2 metrics are related to symptoms. So what we call influenza-like illnesses and COVID-19 syndromic illnesses. These are individuals that are presenting to the emergency department. So we monitor what percentage of all of those visits are, number 1, related to influenza-like illnesses, which by definition is a fever of 100 or more, cough and or sore throat. So that's one metric. The second metric is the syndromic, COVID-19 syndromic cases that present to the emergency room. That also includes fever, cough, as well as difficulty breathing. So our epidemiology program monitors that information with reports from the hospital emergency departments to our epidemiology program on a daily basis. So we have done well in those first 2 metrics. We have a downward trajectory, and what the federal guidelines say is that you need to have a downward trajectory for the past 14 days, and we do check both of those off. So we're good there. So that's 1 and 2. The third metric is the percentage of positive tests to the overall number of tests performed, and we want to see a downward trajectory in that metric over the past 14 days. And so far we are seeing, so that's a check. So that's metric number 3. The fourth metric is related to our hospital capacity. So it states that we are not operating under a crisis care model, which is a model that's utilized or implemented if we have, if our healthcare system is being overburdened and we have reached or surpassed the capacity that we have. And we can place a check there because we have not exhausted our overall local hospital bed capacity. We are about 65 to 68% of that total capacity. And that would include looking also at our ICU beds, which are a component of those that are hospitalized. So we review that information every day. So that number is also in a downward trajectory. The fifth and last metric is related to testing. And you've heard our agency director talk about the T3 strategy that we are standing up. So testing, a robust testing program is the fifth metric. It is also the first indicator for the governor's California's roadmap to modify the stay-at-home order. So that's testing, contact tracing, and isolation. Again, that is being referred to locally as T3. So in terms of testing, we have formed a laboratory testing task force with representatives from all of the hospital systems, our community clinics that are testing, and that is being led by our laboratory director from our county public health lab. And they actually are meeting now. And they've been meeting Monday, Wednesday, and Friday this week, and we'll continue that next week. The week prior, we reached out to all of them and surveyed them to get information about barriers. And we wanted to get that information so we could come to the table on Monday with solutions to those barriers. So we've looked at targets, and we're trying to implement a robust testing. So we've looked at the testing across all of the systems, historically, how much, what percentage did they contribute, and then we want to develop a process for them, which we have, not a process, but a guideline as to who should be tested. And essentially, pretty much anyone who wants to be tested, but we're trying to focus on those at-risk groups. So our healthcare workers, our first responders, as well as locations where we are having outbreaks in our congregate care facilities. We want to test the staff and the residents there. Individuals that have underlying medical conditions, older individuals, individuals from various race and ethnic groups, including Native Americans, our rural areas. Those are all major categories by where we want to get testing. So we developed a hot spot map, and that helps us to identify where to stand up a testing center. We currently have 3 permanent testing sites across the county, one in North Region at the Livewell San Diego North Inland Center, and then at the South Bay in Oxford Public Health or Livewell Center, and then in Mission Valley at the old stadium. We are also working with our Native American communities, other individuals throughout the county to deploy testing centers to other locations, and we'll be making those announcements. And so, and the state has also provided resources for permanent testing centers, so we are deciding where to place those, and we'll be announcing that to electeds in those. We've already made or let El Cajon know that we are looking at Grossmont. We will be looking at some other areas, again, based on where we feel the need is, based on the data, not where we feel, based on what the data shows us where we should be placing testing centers. So I think I'll stop there. I know the dot point here is T3 is coming, testing, treatment, and it's actually testing, tracing, and treatment. So with all of this robust testing that we are implementing, and it's not just the county, we are asking our hospital partners and community clinic partners to also think about how they can increase testing, and they can increase by starting with their staff, because they are our first responders and healthcare workers. And we know that with testing, we're going to have an increased number of positive tests. But as I noted this morning in another meeting, these positive individuals that are positive, they're out there. We just want to identify them so that we can conduct the appropriate contact tracing to identify others that may have been exposed and make sure that they are not exposing others. And when someone is positive, they will need to be isolated. We know that about 80% of individuals that are infected are have mild to moderate symptoms and can isolate at home. And the others obviously would be hospitalized. And unfortunately, a small percentage of those that are hospitalized, about 36%, are admitted to the ICU. So again, I will stop there.
Dr. Nick?
Thank you, and thank you all, and thank you, Dr. Wooten. If I may, I'm just going to make a few follow-up comments of my own, and we'll save the majority of the time to answer questions. First off, I want to say and do a couple level sets that I think are very important for all of us to keep in mind, because from my perspective, it is clear and factually accurate to say that San Diego was actually ahead of the curve compared to Sacramento, in that we declared our emergency on Valentine's Day symbolically as a proactive act of love for our region, with a desire to collect as many of the resources and be positioned optimally. We State followed, as I recall, declared their emergency on March 5th. We instituted, under Dr. Wooten's leadership, our initial social distancing interventions, announced them on March 16th. They took effect at 12:01 a.m. on March 17th. and the state did so a few days later at the end of that week on March 20th. The one thing that I just think from a medical and a policy perspective that is so critical to bear in mind, and it is so important that it bears repeating, that we had the opportunity to be more stringent and to get, if you would, our community safely taking cover earlier, but we do not, at a local level, as is my understanding, have the opportunity to autonomously be ahead of the state and the governor's authority to then be making decisions in the opposite direction. So that's one thing I wanted to share from a clinical policy sort of congruence perspective. The other thing that I need to put on the table is the realities that we are facing that are very, very distinct to San Diego County. I have been quoted, and I believe it with all my heart, though it's a little bit subjective to say this, that we are the most locked and loaded region of the entire nation. But as coincidence and reality would have it, we are an international border town. And for a host of reasons, we are facing the reality that our neighbors just south of us are really in a difficult position. There is a tremendous number of expats and American citizens who live in northern Baja. There are many, many key and essential hospital employees that our regional health system is absolutely dependent on to function, that commute back and forth from Baja. And there are individuals who have every right legally as permanent residents, some of them, for example, coming to the United States twice a week for essential services like dialysis, that the reality of our proximity to the border is one in all of the discussions that we have to have in light of the humanitarian crisis that is unfolding there, that we cannot separate ourselves from. And I just want to illustrate that because, as Dr. Wooten said, the fifth criteria from the federal perspective is really the capacity of our healthcare system. We have been passionate in doing what we're doing, obviously primarily for the health and well-being of our community and the safety of our residents, but we are passionate about the need to protect the capacity of our healthcare system, especially the capacity at the higher levels in terms of the most acute care needs of individuals who are facing life-threatening illnesses. And just for context, folks, as timing would have it, in the last 24 hours, and I asked him for permission to share this, and that is the CEO of Scripps Health, Chris Van Gorder. Scripps Chula Vista is literally near full capacity of their intensive care beds at the moment. They have already been shifting patients up to Scripps Mercy, which is also at near capacity at this very moment. And in the last 12 hours, for the first time, there are now patients being moved, intensive care patients, from Scripps Mercy to Scripps La Jolla and even Scripps Encinitas in order to protect and maintain the capacity of the hospitals in South Bay. I do not want to be alarmist, but in anything that we discuss today, as somebody who is all about business, all about the economic vitality of our region, all about the urgency that we have for folks to get back to work, we absolutely have to be stewards of the highest level of care capacity in our region. And what is so humbling about the circumstances that we are facing in Baja is the situation there is getting so critical that I cannot tell you, nor can Dr. Wooten or any of us, if what is being experienced there is in the top of the second inning, in the third inning, or even in the bottom of the first. We truly have no idea. And I will lastly say, in total solidarity with Dr. Wooten and the county clinical leadership, the fact that we in San Diego did what we did and have the capacity and the margins that we do now within our healthcare system is a blessing that I am so thankful for, because there are other jurisdictions and parts of our own nation, and I don't need to name the cities, that if they were close to Tijuana or Baja California, there potentially could have been an utter catastrophic reality that we would have had to face. And so in the midst of all of these details and all of these considerations, and I'm happy to talk more to share this thing that I keep hearing about coronavirus being a lot less serious than the flu. That is not factually accurate in any way. And so just want to make it clear, as clinicians, as the clinical leadership and stewards of your county, we never imagined the day that we would be making the kind of decisions that we have to preserve human life, but at the same time making the consequences unintended and inevitable that have led to the situation that we are in. And we are passionate, Dr. Wooten and myself and McDonald and all the physicians and policymakers at the county pore over the data on a daily basis, realizing the strain, the burden, the impact of the current state having on all of us. So again, I'm blessed with a little bit too much verbosity, happy to go on, but I'll leave it at that and happy to answer questions, especially if you want to hear some salient things with regard to the distinctives between the flu and coronavirus and all of that stuff. So with that, Mayor, I'll turn it back to you, Mayor Voss. Thank you, sir.
Thank you. Appreciate it, Dr. Nick and Dr. Wooten. You know, this is an unusual opportunity at Sandag. Every one of our jurisdictions is represented, so we have an opportunity to put on our regional hats and tackle the issues that transcend our borders, and an opportunity today for collaborative dialogue. I look forward to questions. Let me start it off with one, and then I will go to Mayor Salas. I know she's been waiting, even though she's not on camera there. I read a lot about a disproportionate impact of coronavirus on communities of color. How are we addressing that? If you give us some backdrop and what it looks like going forward.
Thank you for that question, Mayor Voss. Yes, that has been in the national news across the country. San Diego's picture is not that. Of our total population, we are 51% of our cases are in whites, about 36% are in Latino or Hispanic, 8% are in Asian, and then now it's about 4% in African Americans and 1% in each of the other, whether it is Native Americans or Pacific Islanders. So we are not seeing the disproportionality to the extent that other jurisdictions, particularly in the southern region of the United States. Keep in mind that those that are infected and have greater complications include older adults, include individuals with underlying medical conditions. And in the southern U.S., there is a lot of underlying medical conditions that may put someone at increased risk for contracting and having complications. We feel that our older adult population and those with underlying medical conditions heard us, and they adhere to the strong recommendation of staying at home. About 51% of our total population is between 20 and 49 years of age. And then the other larger population, those individuals over 70%, I think is under 20%. And I'm doing this by memory, but all of this information is on our website, www.coronavirus-sd.com. And if you go to the map with the stick pin in it, you click on that and you can find our cases and our deaths broken down by race and ethnicity and other demographics, including age and gender.
Thank you for that.
Thank you. And
Dr.
can I just quickly follow up with a couple comments, because the whole issue that Dr. Wooten emphasized with regard to how critical testing is, it wasn't until the last couple weeks that we really had challenges in terms of the availability of what we needed to do testing as a region. And that was completely out of our regional control. I think you're all aware that there are national dynamics and state dynamics at play and so forth. And so it was very fascinating, because when some of the initial zip code, if you would, summaries came out, rather than it being a reflection of the socioeconomic composition of those zip codes, likely early on, it was more the accessibility and availability of certain parts of the county that were close to healthcare epicenters and so forth that had testing. And so the issue of testing, to me, is so critical. And what's interesting, even in comparison to the flu, is how contagious coronavirus is, and the reality of how long its incubation period is. Those of you who were involved, I see Mayor Faulconer, with hepatitis, know that the big challenge with hepatitis was a long incubation period. Coronavirus has a long incubation period, folks, up to 14 days. Influenza is a lot shorter. And the reality that we now know that there is likely asymptomatic transmission happening really means that you could get infected based on wherever you were. It may or may not have a reflection to do with where you put your head down at night, number one. Number two, in terms of disproportionality, I will emphasize this because it's such an important point, and Dr. Wooten mentioned it. Whereas the virus has no socioeconomic limitations, it has no zip code considerations, it has no border considerations, it is now everywhere and occurring, and transmission is occurring and equally potentially impacting us all. But in terms of the impact on the human host that it has, socioeconomic individuals who have disproportionate burdens of higher underlying cardiovascular disease, diabetes, pulmonary disease, renal disease, other diseases, those populations are at much higher risk of experiencing the consequences. And hence, even though the virus doesn't discriminate in any way as to who it will infect, the potential impacts that it will have clinically on individuals are definitely potentially more disproportionate. As Dr. Wooten said, though, when you look at the ultimate unfortunate outcome, that being death, even though we are a Caucasian minority county, just above 51%, I think it is, Dr. Wooten, of the current deaths are happening in Caucasians. And frankly, last point I'll make is some of that is related to the higher likelihood of unfortunate risk, if you would, and vulnerability, as you all are very familiar, of infections and deaths occurring in certain congregate care facilities. So I just want to make it very clear from a zip code perspective, the virus has no bounds in terms of the impact that it has on us human hosts. That is very influenced by the underlying condition, which is influenced by folks' socioeconomic status. Thank you.
Thank you. Thank you both. We will go to other questions now. I want to ask you all to keep your questions as succinct as possible. And maybe Dr. Nick and Dr. Wooten are going to have to be more succinct and not feed us so much information. But we appreciate you being there. We'll go first to Mayor Salas, and then we will go to Mayor Faulconer.
Okay, thank you, Chair Voss. And first of all, I did want to thank the county for implementing a countywide mask ordinance, because I think that's what's really important is that the messaging and the information be consistent and factual throughout San Diego County. And it makes it very difficult for communities that are experiencing greater numbers of outbreak of this to convince our citizens to, hold the line and keep practicing their safe protocols if they see other communities that are loosening restrictions and we're still in the midst of this. I had a question relative to the downward trajectory benchmarks that are being met and the percentage of positive test versus the test performed. And I know that countywide, the positive cases that are coming back are about 6.5%. But what I really need to understand is what percentage is really localized, like in what percentage of South Bay cases are coming back positive relative to other areas. That's my first point. The second point is that we're all in this together. And so while we in the South Bay are experiencing this outbreak, and Dr. Nick talked about the contagion rate and how easily it is to be contained, and that, the people that the cases are being reported as to where you live and not necessarily where you contacted the virus. So the question is that in identifying the hotspots, are we creating a false sense of security that we're out of the woods in San Diego County?
Thank you,
Absolutely not. There is no false sense of security. Each day, we look at the change in the number of positives from the day before. And so we still are at over 100 there. So while overall collectively cases are, hospitalizations we are seeing that, and deaths going down, we still are seeing an increase in numbers every day, but it is the percentage of the total number of tests that we are looking at. And based on the fact that the hotspots tell you where all of the positive tests are across the entire region, the percentage is a cumulative for any given day. That's the way we're looking at it now. For yesterday, that's the data that you'll see at 2:30 this afternoon, of the total number of tests, and actually it's not yesterday, it's the day before. So today is the 1st, so for the 29th, that's the data that you'll see today. Of the total number of tests performed, what is the percentage that is positive? And we're still tweaking with how to present that information, but that is what we have. Previously, we were looking at it cumulatively, but that was not the best representation. So now we're looking at what tests are performed, all tests performed, and then looking at the number of the positive tests, the percentage of that. So that's what we are looking at today, and stratifying that by the various geographic areas of the county. We were asked to do that yesterday, and we're working on doing that. But still, when you do the hotspots, based on the zip codes, it tells you where of the people that were tested. And as we test more people, we expect to see more hotspots because more people will be known to be positive. But these individuals will be positive irregardless of whether we tested or not. But now we know where they are, and we can include that in our demographic documents. And we do post on our website not only the percentage, that slide, but just the zip code. So each of your municipalities, you know where your positive tests are. And I also wanted to make a point, just for brevity, and I'm going to stop, is that not only do we want to know about the numbers of tests, but how does that work out by 100,000 population? So someone could have a higher number, but based on your overall population, it could be small, and another jurisdiction might have a rate that's higher than yours. And we really, as epidemiologists, look at the rate.
Thank you, Dr. Wooten. Let's go to Mayor Faulconer.
Thank you, Mr. Chairman. It's good to see most of you, or those that I could see. And to Dr. Wooten, Dr. Nick, and I think Nick Macchione is on. First and foremost, let me say thank you for all of the very hard and good work that you are doing at the county. I think one of the hallmarks, and I'm on the calls with other mayors across the state often, is our communication. That is not always the case in other places. So first and foremost, thank you. This is evidence of that as well. A couple other things, maybe a comment and then a question. The comment on, as we look at the, Dr. Wooten, as you're briefing every day on the metrics in terms of, Mary was getting to this, all of the different metrics that we would need to meet before opening up. I appreciate that, because I think when we're clear on that, that gives the public a sense of where we're heading. So those daily briefings are good as you continue to refine those in those charts. And as I know, there's going to be an item at the board on Board of Supervisors on a Tuesday, work that the countywide economic recovery group has been doing on businesses, so that when the statewide order is lifted, that we as in the San Diego region, countywide, have a set of standards, have a set of protocols that we are ready to go. And I think all of us as mayors are spending a whole lot of time on that. And I'm looking forward to talking more about the efforts of that group. There's another conference call or video call today, but setting us up for when those standards are listed, that we are ready to open in the manner in which we're allowed to do that, and the governor's restrictions, et cetera. So our region is ready. And everybody's been putting a lot of work into that. The only other thing I would say, question-wise, and Dr. Wooten, you just got to this a little bit on testing. Us being able to meet our testing goals, and then of course our contact tracing goals. I know you're spending a lot of time on that. Maybe you can give us an update on how that's going, and anything that we can do as mayors to help either with the testing, or maybe you don't need that help, but the hiring the folks to do the tracing.
Thank you for the question, Mayor Faulconer. Yes, a lot of effort is going into testing, tracing, which is contact tracing or contact investigation, and then the isolation piece is a part of treatment. And just focusing on testing, and this may not be, this is the best information that we have, and we are utilizing it to determine a baseline goal to achieve. Recently, there was an article from Harvard researchers, and it is also being touted by the federal government and the state that we should test about 152 individuals per 100,000 population. And you heard me talk about that's the rate per 100,000 population. So we do the math on our 3.4 million population. That's going to be approximately 5,168 tests daily. So what our laboratory task force has done is historically looked at how many tests have been performed. We asked the systems about barriers, and then we tried to calculate what proportion does each system need to contribute, knowing that many would be doing more, which would be the example for the county, but asking everyone to identify a niche, if you will, given all of the priority groups that we have identified that should be tested. And to be quite honest with you, that prioritization framework gives us a large amount of latitude. So it looks at testing the vulnerable populations that I mentioned. It looks at testing healthcare workers, essential workers, first responders, infrastructure workers like food systems or transportation. So it gives us a large latitude for testing. And then the county government is focusing on long-term care facilities because we've had a significant number of outbreaks in those groups. So we are focusing there to test staff and residents. So I'll
Thank you for that.
there. Mm-hmm.
Vice Chair Blakespear.
Yes, thank you very much for the presentation. I know you spent a lot of time talking about the testing and you didn't quite get to the tracing in that the answer to Mayor Faulconer's question, but I understand there's a lot of discussion about it, but it seems to me that all the information is that there is enough PPE, there are enough community clinics, there are enough tests, but for some reason we're still having a really hard time actually getting the pipeline wide enough to create more testing, even though all this ability to do it is there now. So I'm wondering if there's any way the county could light a fire by requiring, for example, all congregate care nursing homes to test every 14 days, every patient, everyone working in there, to get this going faster. Because it does seem like of 5 criteria, if that's the last one and it's under our control and we have the capacity, why can't we turn that light on faster? I guess that's really the heart of my question.
Thank you. We have turned the light on the long-term care facilities, SNFs.
That's the only thing this way.
That is a primary focus where we are asking them. I mean, we can't demand that they be tested, but we put it out there that this is a resource that we are providing. And for all of the areas, the SNFs and long-term care facilities that have had outbreaks, we are testing all of those. So we've begun that process already. We are encouraging the healthcare systems to test their employees. Your comment about every 14 days, that's something in terms of the frequency we will are looking at. But first, we want to do the baseline testing so we can know what that status is. So we have set aggressive goals for testing, and our task force is working within each of the members are working within each of their systems to do that. Now, the other thing about contact tracing is for each case, so we have about 150 individuals now focused on case investigations, and then when we have outbreaks, and we're bringing on more staff to do the follow-up because as we test more people, we're going to have more cases, and we need more staff to help with the contact tracing. So we will be bringing on upwards of 350 individuals to work on the contact tracing for all of these cases that the cases that will be generated and the contacts associated with those cases.
Thank you, Doctor. Nick, anything you want to add?
No.
Nope. Okay. Let's go to Mayor Minto. John? You need to unmute your microphone.
Okay, great. Thanks.
There you go.
Sorry. Double push the button. I don't know if you have a cure for that or not. Hey, thanks for coming on here today, because this is a great opportunity. I think all of us would like to sit in the room with you and just ask question after question, and this is the closest thing we can get to that. So my questions surround the testing and things of that nature also. We see every day confirmed cases and how they're escalating. And I know that a couple days ago, there was a question that was posed and there was an answer to an estimate on recoveries for those cases that have been reported. So, but my concern is the estimated recoveries. Is there a way to create a system or conduct follow-ups to actually get a closer number on the estimate? And the reason why I ask that is because people in our communities are just seeing the numbers that are being reported of the cases. And so I think there's a sense that there's still that many people that are sick in our community, and that may not actually be the case. And I want to give people hope that people are recovering and that the number is actually going down for the number of people in our communities that are actually sick with the virus. And then I'll ask this last question, get out of here, and let you answer this. But I've heard of testing stations being placed in South Bay and San Diego, and I think a couple in North County. But unless I've missed it, are there any plans to put testing stations out in each county, like Santee, El Cajon, Lemon Grove, La Mesa, and even into more rural areas out in Lakeside or Huckumber or someplace else? Thank you very much.
So I will start with the testing sites. We are getting resources from the state, and El Cajon was the first location that we identified from our hotspot map or heat map that a testing site should be located. So we have communicated, if I understand, with elected officials. City manager is who we communicated with about the El Cajon location. But we have since found out that we will be getting more additional support from the state. So we are looking at what other locations we will be locating permanent drive-through, but we will also be looking at where locations we can utilize our mobile van to go for any given day. That's not a permanent site, so that we can go throughout the county. So that's the testing location. The recovery, I think that was first seen on the Johns Hopkins web dashboard, and that is a calculated number. We would have to probably hire another 300 staff in order to do the legwork to find out exactly when someone recovers. So what we use, and the Council on State and Territorial Epidemiologists is coming up with a mathematic model to calculate that, because, and what that would entail is utilizing 10 days from people that are self-isolating at home, and for the hospitals, anywhere from 14 days for hospitalization in general, and maybe 30 days for people that are in the ICU, and then you have to subtract out the individuals that died. And that will give you that recovery number. There is no jurisdiction across the U.S. that is doing the follow-up with people and asking them, when did you recover? So we have to calculate that number, and we include that in the daily reports.
Thank you, Dr. Wooten.
Sure.
We'll go next to Mayor Bailey, and then we'll have Council President Gomez, and then Supervisor Desmond. And we need to keep these questions brief.
Thank you for your work and presentation today, everyone. Much appreciated. 3 questions. Capacity. How many beds do we have countywide, and how many are currently occupied by COVID-19 patients?
Mm-hmm. I'll start and then have Dr. Ifantides comment. County-wide, we have licensed beds at, and this is non-federal, this is all civilian hospitals, about 6,900. And then that's licensed. That means, but it doesn't mean how many they are, the bed capacity. Just for instance, at our psych hospital, we might have, I will just use a round number, 120 beds that are licensed, but we are only using X percentage of that. So that's in that graphic that Supervisor Fletcher shows every day. There are 2 lines. The very top that says non-federal licensed beds, and then the second line is the capacity. And I think that's about 5,290 or so. And then what you see are the daily hospitalization census. And so there's about a 20 to 30% difference between the numbers of beds that are filled and then what's the gap or capacity that's still left. And that's a graphic that's shown every day by Supervisor Fletcher. Dr. Nick, do you have any other additional comments?
Thank you. Real quick, a couple comments. The irony of this whole unprecedented adventure, as you all have well heard, is the financial crush that's also been had on our healthcare systems, to the point where there have been some layoffs. So beds don't care for patients by themselves. The number of beds versus the number of staff and PPE is something that we are daily monitoring. The other thing, Mayor Bailey, to your point that I think is very relevant, to me, the real critical point of all of this is the intensive care capacity. And like I said, if you were on from the beginning, the last 48 hours, I'm not going to say it's stress, but utilization there is increasing. And just as an important number, because I don't know that we talk about the number of ventilators and so on and so forth. But in the civilian realm right now, we have 540 intensive care beds available. There are things that we have up our sleeve, for example, turning operating rooms with ventilators into ICU beds and so forth. Should that demand occur, that could increase that number. But just wanted to answer that for you, sir.
No, thank you. And so,
Richard,
just make sure.
Real quick. We got questions.
I just want to make sure. I didn't hear an answer on how many of the beds are occupied by COVID-19 patients.
I was just about to provide that, and I just want to make a correction. The 6,900 is the non-federal, those are the licensed beds. That 5,600 is that next line. And then of each histogram, the bottom part is the orange. We have about roughly between 350 and 380 patients that are COVID, and that fluctuates from day to day.
Okay, thank you.
Let's go to Council President Gomez.
Thank you. And thank you, Dr. Wooten, and everybody else that really has been doing an incredible job. And definitely, I'm very appreciative of leading these efforts based on data and science. And I really want to continue to encourage you to continue doing so. I think it is the right thing to do. I know that we're all trying to get back to this so-called normality, but I think you stated it at the beginning that there's a lot at stake, and we need to do it correctly, not because you're trying to harm people, we're trying to save people. So I really appreciate that and definitely support that approach. The question that I have actually is a follow-up to Mayor Voss' original question, and that is just overall the nation's reference to COVID impacting for the majority of people of color in underserved communities. And that's not what we're seeing here, which is good. The question that I have on that is, are we not seeing it here because it's just not happening, or do we have enough data to conclude? Because I do wonder that. I don't know what the answer is.
Thank you, Georgette.
Wilma?
Dr. Nick, go ahead.
I would like to think is that people are listening to the orders and recommendations that we've been given out since we declared the local emergency on February 14th. So that's, the evidence is the evidence, and we feel people are adhering to the messages. I mean, I know there's a small group of people that may not, based on the people that are protesting on the weekends, but by and large, the data, the Google data that we've shared with you previously, and there's some other Apple data, but it shows that people are by and large paying attention and adhering to the recommendations that are being made.
Mm-hmm.
Thank you.
So thank you for that. So I mean, because and I'm sorry for keep drumming the same beat, but I really want to get an answer that I can be satisfied. Not that I'm not, because I represent some of those communities, and I'm always constantly thinking about that in terms of what is happening in the district. We're seeing that economic impact is hitting certain communities pretty high. I mean, in my district, is 30% of the unemployment is in my district. How does that translate to healthcare access or lack of? And how do we conclude, well, it's not happening here? So what I'm asking is, are we doing an extra intentional outreach to these particular communities to really conclude, okay, we're good? And if not, maybe that's something that we can think about doing, just because it worries me. I mean, I saw the maps that SANDAC created in terms of unemployment. The major areas are within the Mid-City area, Southeastern and Southern San Diego, meaning District 8, District 4, and District 9. Within the region, collectively, we have a huge unemployment. And really those tend to be the most impoverished communities. So I just really want us to think about it as we move forward, how we can really have that answer where we can feel certain.
Can I say one? Can I say one thing real quick? Well, no. One real quick thing that I'm really, collectively blessed by in terms of what we've done for our region. Even for individuals who don't have healthcare insurance, I can tell you that we are a national leader in our partnership with 211, with our integration with the federally qualified health centers, with having stood up a nurse triage hotline, of having a mechanism of referrals and so forth. And so I'll let Dr. Wooten take it from here, but I want to say, in as much as we are focused on the most at-risk population, we have stood up, I believe, some amazing opportunities where, with as virtualized as things have become during the COVID crisis, that access is truly available to every member of our community. And I am just so thankful and would just really emphasize how critical and how just and how fair and how appropriate that is. Dr. Wooten?
Yes, Councilmember Gomez, as I constantly remind people, I am the public health officer for all 3.4 million people in San Diego County. And in framing or developing the framework for testing, you may not have that, but we can send it out to you. Racial and ethnic groups is called out as a priority group. In addition to Native Americans, rural individuals in rural areas, as well as HIV, people that have HIV and AIDS. So we tried to make sure that we included all of the high-risk groups and groups that might potentially be marginalized or not thought of. So that has been thought of. It's in our framework, and we can send that to you so that you can have that available.
Let's go to Supervisor Desmond.
Well, thank you. And I just want to say thank you to all the people at the county, Dr. Wooten, Dr. Nick. There's literally thousands of people out there pulling this all together. The Emergency Operations Center, they're dealing with the border, they're dealing with cruise ships, they're dealing with, the police and sheriff's departments, they're dealing with the shelters, the logistics of the equipment, and just a huge amount of things. And they're juggling there at the county. And I really want to just give a shout out to all those folks. But Dr. Wooten, I had a question for you in the beginning. You had mentioned the 5 criteria that the county is trying to do. We're still working on the testing portion of that. There's a lot of anxiety out there with people, trying to get back to work. And how does those 5 criteria that the county has set up, how do they mesh in with what the governor is saying with the essential businesses? If we meet our 5 criteria, then we're good to go with the governors, or we're waiting on the governor. I'm just kind of curious how this is going to play out.
Well, that's a great question, Supervisor Desmond. These 5 metrics are based on the national guidelines, and they align with the governor's roadmap in terms of the number of cases, hospitalizations, those metrics going in a downward direction, and then testing, which is the first of the 6 indicators in the governor's roadmap to modify the stay-at-home orders. So all of the efforts that we are working on take into account the federal guidelines as well as the state guidelines, and having those accomplished or met so that when the governor gives the go-ahead to open back up, we can do so gradually, because it's not going to be flipping a switch to go from where we are now to where we are before we declared the emergency. It's going to be a gradual dialing back up of bringing things on. So I would imagine gradually we're not going to be gathering. So right now there are no gatherings, because that's how you transmit disease. Only household members, not even family members, just household members can gather, say, at parks. As you know, there's no gathering on the beach. You can walk, it's active going through the beach. And then,
Well, just to kind of add on to that, so do we want to meet all of our 5 metrics
Yes,
before before we start moving along when the governor's phases? I guess I'm trying to figure out which one comes first, so they have to both come together. How those metrics, you're looking at those, how they need to be in place to basically start opening up businesses as the governor allows.
yeah, the federal government has the phases 1, 2, 3, and 4, and the state has stages. And I don't know why they don't use the same terminology. So we are going to be developing a crosswalk between feds and the state, the phases at the fed level and the stages at the state level. While they might be named different things, the components are very similar. But in terms of opening back up businesses, we cannot do that until the governor gives us the go-ahead to do so.
Okay, but we want to have all these criteria met before we do that as well.
That is correct, sir. And not just those 5 criteria, but have businesses have their plans in place so that when we are ready to open up, they are ready to go as well, because there are things that we will be asking them to do once we start dialing back up.
And thank you for the great job you're doing. I appreciate it. Thanks.
Thank you, sir.
Can I make one follow-up comment? Mayor Faulconer alluded to it. I alluded to it in the beginning, and I think this is so critical. Absolute level setting, and throw things at me virtually for what I'm about to say. The goal for San Diego is to be proactive in meeting the designated criteria. There well could be a scenario where we are meeting our criteria, but maybe the rest of the state isn't, and that we would not be granted a regional authority to do things ahead of what Sacramento is doing. Again, as I said at the beginning, we were ahead of the state in being more restrictive. The capacity for us as a region to be more proactive in turning the dial ahead of the state, unless we go down some kind of a legal adventure, is not on the radar screen. And so I think it is so important for all of you, some of you that I have the blessing of interacting with quite frequently through different vehicles. You know, I feel like every day you're trying to get Dr. Wooten and I to do things that even if all of these things were met, we are, I don't want to say at the mercy, but dependent on the authority of Gavin Newsom to make decisions. Hopefully, when those decisions are made, we meet the criteria and can proceed accordingly. Thank you.
Thank you. Let's go to Mayor Haviland.
Can I just make one comment and follow up to Dr. Nick? Some good news is last night I was on a call with the state. The state is looking at regional opening up in regions. So that's, I think, positive. And Southern California as a region could open up before other regions throughout the state. So the state is looking at that, and we will provide you additional information as we get it. Thank you.
Let's go to Mayor Haviland. We only have about 12 or 13 minutes left with Dr. Wooten. I'm not sure what Dr. Nick's timeline is, so let's keep this moving. Mayor Haviland.
Great. I promise to be quick. Thank you very much for all you're doing to keep us well informed and safe. My question is regards to testing, because that's so critical to all of us being able to open up our economies again, which we are so eager to do when it's safe. I want to know, is testing available to all San Diego residents for free? You see that that's the case in LA County. If that's also the case here, I think we should be promoting that to try to encourage people who need to have testing done to do so.
Yes, ma'am. There is no fee or charge at any of the county testing sites. We have never charged. We have the capacity to test in a 16-hour period of time, 1,000 plus individuals. So we do not charge. You may have heard of pop-ups that do charge, but that is not really sanctioned by the County of San Diego. So there is no charge. If providers, if individuals are tested through their system, their healthcare system is a part of their healthcare system. But for any tests that are conducted through our county public health testing site, there has never been, and there is no current charge, and we don't plan to charge.
Great, thank you. I have a question from Mayor Ritter of Vista, who was having trouble with her system, so it got texted to me. Vista's count is 53 since the beginning of counting. Can that be broken out to how many of those have recovered, how many are in the hospital, how many in ICU, and how many may have passed away? Why has Carlsbad stayed at 50 for several weeks? Do they have no new cases? Who wants to take that?
I didn't hear I'm sorry, could you repeat the question? I didn't hear the first part.
Sure, this is from Mayor Ritter of Vista. She says their count is 53 in Vista since the beginning of counting. Can that be broken out to how many of those have recovered, how many in the hospital, how many in ICU, how many have passed away?
I mean, it could be broken out. But you know, the question we always ask is, you know, to what end? I mean, what will having it broken out, what, it's just that it would take additional time, and we would have to deploy staff to analyze that data, broken out in that way. And yes, that's the answer.
Okay. Can we get Mayor Jones up on the screen, please? Rebecca Jones has disappeared from my screen, but she's in my queue.
Am
There she is.
I
There
here?
you go.
Can you hear me?
Yes.
Okay, my question is about hospitals. Are non-San Diego County residents being treated in our hospitals right now? And if they are, how are we accounting for those non-county residents in our numbers? I'm unclear as to how that works.
So the numbers that we report
Go ahead, Dr.
The numbers that we report from day to day now are only San Diego County residents. We do track non-San Diego County residents. Those would be individuals that might be in the military, on the military basis, that are not from San Diego, or when we have the repatriates here and the cruise ship individuals that were on Miramar base. We track all individuals, but the information that we are reporting is just for San Diego residents.
And I want to follow up. Thank you, Dr. Wooten, and thank you, Mayor Jones. This is a very important issue. You heard what Dr. Wooten just said in terms of the numbers that we are reporting. If you are getting to the fact of who is being treated, San Diego is a resource. Imperial County has already reached times where it ran out of capacity. So we have already been providing support to Imperial County. Currently, the president's policy at the border is for certain types of travel that is possible. There are individuals that find ways to get across despite what legal guidelines there are. If those people are in need, our hospitals treat them. There are definitely individuals who are American citizens who are living south of the border who are absolutely receiving care at various healthcare facilities in our county. And yes, there are permanent residents that are not living here full time, but may have dual locations and so forth. So if the spirit of what you're asking is data, that's one thing. If what you're asking is about care provision, hospitals take care of who needs care and have to be transparent in telling you, absolutely, there are non-San Diegans that are receiving care in many of our hospitals.
So just to tag on to that, so when we're saying how many people are in our hospitals, in ICU, and those numbers don't necessarily depict residents of the county. I think it would be helpful if we somehow could track that and have the knowledge of what that number is.
Let me follow up and let me make a distinction in terms of, again, the issue between positive test results and the guidelines associated with that, which you see in the reports and the results from Dr. Wooten on a daily basis. I think you've all heard about media and scenarios, again, with the cruises, with individuals who live in Orange County but work in San Diego, and all kinds of other scenarios like that. But when it comes to providing care, especially to those who are ill and critically ill, there is not a distinction made in any way as to where they live.
Yeah, nor should there. I mean, we need to take care of people, of course. Yeah.
Dr. Wooten,
Yes.
go ahead.
Yeah, and support what Dr. Isn't stated. In the numbers that are reported every day, those numbers only pertain to San Diego County residents. As you recall, early on, we were reporting San Diego residents, non-residents, and then the repatriates. And because it was confusing for the general public, we stopped reporting both of those categories in a metered approach. We did first with the repatriates and then with the non-San Diego County residents, and now we are only reporting San Diego County residents, but we have the data for those other categories.
All right, thank you.
Thank you. I know Mayor Salas, I believe, has another question.
Yes, I do.
We lost your audio, Mayor.
Yeah.
Okay, hold on.
There you go.
Okay. All right. So the question relates to, it's a follow-up to Mayor Haviland's question relative to the accessibility of testing. And so I had a briefing with Dr. Wooten several days ago and Chairman Cox. And so at that time, they said that, of course, the optimal testing per day would be in excess of 5,600 tests per day. But the question is how fast can we ramp up to the ideal? And also, do we have the information on all these different clinics and hospitals that are providing the test, the number of testing per day? And then the last question is, in the county facilities that are providing the free testing, how many are they doing a day? For example, how many are being conducted at the Oxford Center? And I'm sure that you have that information. How long is it going to take us to ramp up to the 56 a day? Because if I remember the conversation that we had in the briefing, right now, I think we're only testing between 1,200 and 1,800 and 2,000 a day. So please clarify that for me.
Sure. So in the briefing earlier this week, the number is 152 per 100,000 population is 5,168. That is the goal that we've set for ourselves with our local public health laboratory as well as the other systems. This task force that we've developed brings together all of the laboratory directors from all of the hospitals and the community clinics that are conducting testing, which right now is primarily Family Health Centers of San Diego. So we are working on an aggressive plan. So for Monday, the 27th, we did achieve our goal, which was 2,500 tests. The next day, we wanted to do an additional, we didn't meet the goal on Tuesday or Wednesday, but we are still putting things in place that have not yet showed up as additional testing. That's all the long-term care facilities. And now the permanent drive-through test sites that we are developing. I'm hopeful that beginning next week, we will begin to see these numbers increase to the level that we want them to be increased. Now, every day this week, we tested more than we tested last week, but we are just trying to meet that goal. And so we'll reset next week and push, just be aggressive in trying to get individuals tested.
Thank you, Dr. Wooten, but there's still a lot of confusion amongst the public about where and who can get tested at certain sites. So we've got,
So
you know,
I can tell you again, the graphic that we show to simplify the priority list is if individuals have symptoms, it's either a yes or a no. If it is a yes, then they call their healthcare care provider if they're in those priority groups. And pretty much anybody the various priority groups will not eliminate individuals. It will be a very small number of individuals that would potentially be eliminated. So if they have health care, they call their healthcare provider. If they don't, they can call 211 and then ask for our nurse triage line and get scheduled for a test. We try to make that as simple as possible based on all of the priority groups that we are recommending. Again, healthcare workers, first responders, essential workers, vulnerable populations, older adults, individuals with medical needs, high blood pressure, heart disease, chronic lung disease, asthma, diabetes, the various racial groups, Native Americans, those in rural areas, HIV. I mean, most people fit into those categories, and also our long-term care facilities, and in those it's symptomatic or asymptomatic. So particularly for our healthcare workers and our first responders, we're trying to test everyone. So we have a large bucket of those that can be tested. So anyone, essentially, unless you are a young person in college, maybe that might not be the population, but all of the other populations that I have mentioned and those that are at high risk, they can get tested.
so
Thank you, Dr.
can I safely say then that if a member of the public says, you know, how and when can I get tested, then the answer is, if you've got a medical home, call them first. If you don't have a medical home, then call 211. Is it as simple as that?
Absolutely. It's as simple as that. Mm-hmm.
Okay, that's great.
Awesome. Thank you, Mary. As a believer in miracles, I find it remarkable and miraculous that our questions have come to an end at just the time that I know Dr. Wooten needs to leave. Dr. Wooten, we so appreciate you joining us, and Dr. Nick as well. Anything you would like to say in closing?
I just thank you for the opportunity to share the process and for you to help us with our mission. So thank you for this opportunity.
Thank you. Thank you. Dr. Nick, anything in closing?
Mayor Voss, you need to move on to other topics, right?
Actually, what we're going to do is just have some board discussion. So you are welcome to stick with us. It will all be on this topic. So if you can stick, we'd love to have you.
Can I quickly discuss two things from a pure clinical perspective that I think it would be very instructive, because I know part of the dynamic, and again, with the blessing of knowing some of you very well personally, I'm mindful of the fact that you're under siege and your constituents are battering you, stalking you, chasing you, and trying to get you to make miracles, having made the reference that you just did, Mayor Voss, to the miraculous aspect. Two things I want to talk about. First off, and this is purely clinical, not necessarily a public health perspective, the testing. If I may, so critical for all of you to understand that there are two broad categories of tests. And under each one, there are a variety of specific kinds and, if you would, brands of tests. The first category of test is looking for the presence of the actual active infection. They're often called PCR, polymerase chain reaction tests. Those are tests that literally are looking for the presence of the virus in one's body. Those tests we've been doing for several weeks, over a couple months now. And those are the ones that involve, the swabs going deep into the nose, playfully having been described as brain biopsies at times with a Q-tip. Those tests seem to be pretty reliable. But the new emerging tests of a whole different category are broadly called the serum test or the immunity test or the tests that are looking for quantification of different kinds of antibodies in your body as an indication that you have been infected. And there's an assumption, but that's one thing I wanted to clarify for you all, and it's a little bit shocking, but in the spirit of transparency, we have not yet 100% conclusively been able to bow tie the fact that even if you have antibodies, that you're truly immune. And I'll stick to my day job as a local servant. My name is Efantides, not Fauci, but the World Health Organization, the CDC, the NIH, they have not yet definitively concluded, and it's still a little bit early, as to the quantification of what the presence of those antibodies mean in terms of immunity. And let me quickly illustrate this, and I think you'll find it interesting from the perspective of the annual flu. Why do we have to give a flu shot over and over again every year? Because the influenza viruses actually mutate just enough over the course of an annual cycle that we have to keep ahead of them, or at least try to chase them with new vaccines that will infer and confer immunity. Last year's flu shot may not be that meaningful for this year based on the level of genetic mutations and the sequence and the time frame in which that happens. For as scary as it potentially could be, we do not yet have enough experience with this novel virgin virus to know, A, is that mutation happening, and how quickly is that mutation happening? And so, again, I'm just a local guy, but in my heart of hearts, I'm a little bit concerned about assumptions that are being made at a national level and overinterpretation that even if the antibody tests come back as being positive, that is not a guarantee of long-standing immunity. So I just want to put that out there. And then one other thing, because I think if I had a dime for every time I heard that coronavirus is not as bad as the flu, I'd be retired. But let me say a couple things. Coronavirus, the early evidence now, we're far enough into it, 2 or 3 months, it's worse than the flu. And let me illustrate that with a few numbers. In terms of annual tracking, we now have more deaths in our nation. We're pushing 63,000, likely now over 63,000. That's more deaths than were quantified this year from the flu. Again, seasonal flu varies. There's years where the flu death rate is a lot higher based on that mutation and the impact that it has on people's bodies. The death rate, for example, this year, through the most recent data that I could find doing some research, which was 2 days ago, at the peak of the flu season, we had 331 Americans dying per day in the United States. At the peak of the coronavirus infection so far, we have had 739 Americans dying per day in the United States. The other thing about coronavirus, early evidence, it is more contagious. That number that I talked about, if any of you have time to watch press conferences in terms of the the rate of infectivity in a sense in oversimplified terms, for the flu, it's pretty well established that it's 1.28. For coronavirus, we haven't been able to finalize it yet, but it's somewhere between 2 and 3. And in terms of the multiplication of how infectious things are with coronavirus, a number between 2 and 3 implies very quick transmission and spread. And then just a couple other things, and I'll be quiet. Back to the incubation period. With the flu, we now know that when you've been exposed to the flu, you get pretty sick within 2 to 3 days. With coronavirus, it has a long incubation period. And there are people who not only may be spreading the virus before they get symptoms, even more amazingly, and what makes this so complicated and so unprecedented, there are people who are infected that don't have any symptoms whatsoever and will never have any symptoms and are spreading the virus. So that is something to keep in mind as well. And then hopefully you don't need me to remind you, but I will. With the flu, we have something called a vaccine. We have medications like Tamiflu. With coronavirus, we don't have a vaccine. There's some potential preliminary evidence of therapies that are beneficial, but there's no rock solid, airtight, universally agreed upon FDA approved medications. So the next time somebody says, oh, coronavirus, it's not as bad as the flu, please be educated in terms of the truth. I appreciate it.
Dr. Nick, thank you. Really appreciate you being with us. We have no public comment that we've received on this topic. Board members, if you have any further comment or discussion, I would entertain that now. Otherwise, we'll be able to draw this meeting to a close. This is something Dr. Nick and Dr. Wooten in absentia, I hope we can repeat again, a unique forum with all the leaders in the county coming together. So really appreciate your time. Serge Stadina, did you have a question or a comment?
I was just, it's not for Dr. Nick. We appreciate that. Is this now the open comment period, or are we going into the coronavirus?
Well, this is still coronavirus comment. If you're just general public comment, that's going to be in just another minute or two.
Well, okay. No, Dr. Nick, I want to thank you for that science-driven and medicine-driven discussion. I think having that data is really important. As Mayor Salas said, we had that discussion with Dr. Wooten and Supervisor Cox last week with also Mayor Sotelo-Solis. So I appreciate that. What I'd like to alert you is that not only do we have the coronavirus crisis in South County, but our residents are suffering from the Tijuana sewage crisis. And I've requested a meeting with County DH and Public Health and Supervisor Cox, specifically to really make sure that we use that same type of modeling and approach for public health for coronavirus, and especially looking upstream in Mexico at what's happening with this crisis. I literally had to intervene with the governments of the United States and Mexico, personally myself in our city, because the federal government basically told us that the 65 million gallons of raw sewage in the river were from urban runoff or from stormwater. Yesterday, the federal government finally, after we had to intervene with the ambassador of Mexico to the US and the ambassador of the US to Mexico, finally admitted that we have 35 million gallons of raw sewage that they've been dumping in the river for 5 months. And so we urgently need your help. Our residents are getting sick. The residents of San Ysidro and South County are getting sick from what's in the air. I think that I got sick in March when this was happening, but pollution levels are off the charts. It's literally eviscerating South County residents. And this crisis on top of a crisis is creating a crisis for our city. And I know the residents of South County. So I appreciate the science-driven approach. We need that same approach here because it's literally having a huge impact on public health in South County.
Thanks, Mayor Dedina.
Thank you, sir.
Great, thank you.
Thank you.
Mr. Zito, did you have a comment or a question?
Yeah, I did have a question since Dr. Nick brought it up, and thanks again for the information, and particularly for one of your last comments around the possible mutation. I just wanted to clarify from the perspective of mutation, you did bring up the discussion around the antibody test. Is the implication there, do we feel that the swab test would actually catch possible mutations of this virus? Early on, like 4 weeks ago, there was discussion that different parts of the world might actually have been seeing different mutations of this. And I've been kind of surprised that particular discussion has quieted down, but you bringing it up, I thought was very good and very salient. Thanks.
Yeah, thank you, sir. And if I may, Mr. Zito, a couple quick comments. You know, when it comes to what's called the PCR testing, or the test for the presence of the virus, there is a broad enough genetic footprint of the virus that is being detected that even if certain mutations have occurred, in all likelihood, the test result for that would still be positive. The issue with regard to the antibodies, and what I'm talking about in terms of mutations, and please don't either take this as somebody who's being evasive, I just don't think the science exists yet. My concern is if the mutation is occurring of the virus, and what I mean by mutation is literally, you know, a genetic refiguration of its genetic code, if you would, the immune test could still be positive. But even if you have a positive antibody test, the virus may have genetically mutated and just rediscovered itself enough to where in reality, you're not immune yet. And this is what is so hard. And again, if I may quickly from the heart say the empathy that I have for everybody, you know, the fact that San Diego was so decisive and so proactive, and we have dodged, if you would, the bullet, doesn't mean that there's nothing to see here. Keep moving. It means that we took cover. We are, the illustration I use is well positioned and hidden in the trenches. And as a result of that, our community is safe. But that doesn't mean that we are justified yet to just stand up from the trench as if nothing is going on. And even though it's not politically correct, I've used the illustration before and I'll say it here. I'm concerned about people having their heads blown off prematurely with a false sense of confidence. But all of that in the absolute sensitivity and realization of the flip side devastation, both economic and health, by the way, that is occurring in the context of this unprecedented situation. And that it relates to the comments that I made, I think it was Tuesday, when I talked about the mask. What people don't fully grasp is that this is a virus that has never infected humanity before. We don't have immunity. We don't have vaccines. We don't have treatments that are proven and universal. So yeah, the best solution we have is hiding. And yes, the longer we hide, somebody, one of you, I won't call you out, said, well, more and more people are going to be dying in the trenches. We get that. But that's why we're trying to make decisions in such a thoughtful, data-driven manner and in concert. You know, hopefully, and I'm confident that we will, though the situation in Mexico is still way from being, quote unquote, in control. But I'm confident that we're going to get to where we need to be, contingent then, if it's regionalized or statewide or whatever. That was good intel that Dr. Wooten mentioned from last night's meeting, that we'll be positioned to take actions as quickly as possible. But we can't lose sight in this mentality that there's nothing to see here because we haven't had devastation. I just don't know how to be able to say that more clearly to our community.
Thanks, Dr. Nick. I have two final comments. These will be the two final comments from our board. Mayor Sotelo Solis. You're muted. We can't hear you. Nope, can't hear you still.
1 second, Chairman.
Hang on.
Mayor, you're self-muted.
No. Hello.
There you are.
Okay. Hi, everyone. I just wanted to say thank you again for the presentation. I want to thank staff and our executive committee of SANDAG for making this a priority. I think we've all received information, whether it be on the county elected official phone calls, our individual efforts. But it's great to see that this is a priority for our entire region, and that the SANDAG team is able to make this happen. So kudos, chair, vice chair, executive team, and staff. Yay, you. One of the things that I really wanted to emphasize, and I wanted to share my appreciation to Dr. Nick, is that, again, those underlying health conditions, you know, based off socioeconomic status, it does make a difference. And so thank you for, you know, being a constant voice on that, and that the coronavirus sees no borders, you know, whether it be a street, you know, from the 91950 zip code to the 92139 zip code, it does not know the difference. So two questions. One is, I guess, as a board, do we consider this element of health, or how we could consider this element of health as part of our ongoing discussion, whether it be a presentation or, you know, we do hear the county reports, you know, weekly, and you know, for those that watch it daily, but maybe there just be a one, you know, quick briefing from whether it be Hassan or someone to get that on the reports as part of even the economics, you know, how it plays into our discussions. So that's one. And then for Dr. Nick, looking to the future and beyond, we know that the flu season, again, is going to be coming upon us real soon. And, you know, as we start looking at what we need to do as elected officials, we want to, again, be on that united front. What should we do to help prepare our communities for that element? Again, it may be a bit premature or early, but I think it's never too early to have those introductory discussions or even to consider things. Thank you so much.
Thank you, Mayor. Nick,
Can
let me say quickly, Nick, before you answer the question. From the SANDAG perspective, I felt it was important to bring this forward and have this discussion because it affects every facet of our life. It affects every corner of the county. So it was an important discussion to have, and I can assure you we will do this again, hopefully with Dr. Nick and with Dr. Wooten and other people as appropriate. So just to answer that for you. Now, Dr. Nick.
Thank you, Mayor. And I'm going to try to make this real quick, but again, I'm going to be a little bit vulnerable in about what I'm about to say. Folks, the whole strategic initiative of Live Well San Diego is about health, safety, and thriving. Our region is at the nation's forefront of looking how integrated economic vitality, a sense of security, and health is to the essence of our community. You know, over the last few years, I hope you've all heard the nomenclature of the social determinants of health. That's like the hot thing. I don't like determinants. I think of them as influencers because determinants sound like you are stuck. I believe in grace and the fact that there's always opportunity to be able to move on and for folks' circumstances to improve. And I'm not gloating, and it's not me, but your county leadership, your board of supervisors, tell us something we don't know in terms of the integration of health with economic vitality and safety and security. Honestly, I think of it all as a continuum. And so, Mayor Solis, if I could say, you know, you asked me a question, can I pull out my magic wand for a second? We as clinicians know how important it is for people to get back to work. This has impacted my own family. I've had brothers who've lost their jobs, and nobody's taking these decisions lightly. But if we as a region could be united, it doesn't have to be an either or proposition. It's not either health or economic security. What is so unprecedented about this is the difficult situation that we're in of having made these decisions that I think have saved human lives. Had they not been made, I've used the very graphic illustration that we'd have the blood of humanity on our hands. Well, we saved human lives, and in graphically, we've got the blood of the economy on our hands and vitality on our hands, and we own that, and we get that, and we understand that. Nobody's making those decisions impulsively. But like I playfully said, we have a pandemic here of a virus, but what is aching my heart and many of my colleagues is that we also have a pandemic of polarized opinions. And my answer to your question, if we as a region could stand together united as civic, elected, mayoral, supervisorial, and clinical leadership and say, community, we love you, we care for you, we realize the impact that this is having on all of you. We're not making these decisions lightly. People need to understand how unprecedented this is. And that's what I was getting at the other day, the buffoonery of certain even physicians oversimplifying things and making comments that are blatant, if not lies, but misrepresentations is very counterproductive. And the volume of communications that I get, and not to say that there's not partial truths to some of those things, but come on, people, it's not like we're willfully imposing economic devastation. All of this is driven by love. And so I just would long for, and I have to log off in a moment, but I would just long for a more united perspective. It's not either health or economic security. That's the whole premise of Live Well San Diego. It's integrated health, safety, and vitality. We get that. And that's what we need to preach. That's what we need to promote. We can't be fragmented at different ends of the spectrum. Thank you.
Thanks, Dr. Nick. Mayor Wells, you'll be the final question comment. And Bill, you're muted. There you go. And you need to be quick because Dr. Nick has to leave.
Dr. Nick, just one quick question. My background is in mental health, and I worry about the number of people that are committing suicide, that are becoming drug and alcohol addicted. I would like to know, are we keeping statistics on the increases in 5150s, psychiatric hospital admissions, calls for domestic violence? You know, you get the idea.
Of course, sir. Absolutely. And
oh, I'm sorry.
I'm trying to compose myself because this is a sensitive topic. Because again, it's affected my own family. We are tracking everything that we can track. Okay, and thankfully, data, and this could change because the longer we go into this, the harder it's going to be. Trust you me. If we think it's hard now, who knows what tomorrow holds? Every day we go, it's going to become more and more difficult. Okay, so I think people have demonstrated incredible resilience, but it's becoming harder to maintain. Hence the importance, I think, of messaging and all of that. But as Dr. Bergman and you know, Supervisor Fletcher and others have said, we in San Diego have done a remarkable revolution of how healthcare delivery is being provided. And I will say this, I have seen literally before my eyes a transformation of care delivery that I think was inevitable, but would have taken 10 to 15 years, has happened in less than 3 months. In that, we have a plethora of virtual resources, including Zoom psychotherapy and crisis hotlines and situations where folks have those resources. And so, yes, absolutely, the risk is greater with social and physical isolation, but there does not have to be relational and emotional isolation. And I am thankful for the fact that we live in a county that is robust with a lot of those resources available to it. And all of those things are something that we are looking to grow even further. We are, many of us, isolated physically, but we are not isolated emotionally and in terms of the healthcare delivery that is now available through some very innovative means here in San Diego County. So God bless you all, and thank you, Mayor Voss, for the opportunity of participating today, sir. Thank you.
Dr. Nick, thank you so much. This will bring to a close our discussion of COVID-19. I just want to say, you know, this is a remarkable moment where we need to be caring and kind, as Dr. Nick said, but also responsible. And the only way to do that is all of us working together. So appreciate all of you. Tessa, do we have any public comment that we continued from the beginning of the meeting?
We do not. There is no public comment.
Thank you. I want to thank you all for being here today. Please note our next board meeting is scheduled for next Friday, May the 8th. It will start a little bit later than usual at 10:30 a.m. Thank you very much, all of you, for making time for this today. I think it was an important discussion. Next week, we'll be discussing our draft fiscal year 2021 budget. Until then, stay safe. See you then.